Hi, this is Regina, NCLEX instructor for the ReMar review, and this video will be about why nursing students should take an NCLEX review. Number 1, nursing students should take an NCLEX review because no matter how good of a nursing program you come from, when it's time for you to study for NCLEX, I guarantee you there will be things that you have never heard of, medications you have never given, disease processes you have never encountered, but you will be expected to know them for this exam. I went to a 3-year nursing program, so I got my bachelor's in nursing, and we studied a lot of things during that 3 years. We had lots of skills, lots of research, tons of theory, but when it was time for me to study for NCLEX, there was so much that I did not know or I was not able to retain during those 3 years. And right now I'm tutoring you nursing students in the 12-month, 18-month RN diploma programs, and you're flying through this information. So I am really encouraging you, take the time and get an NCLEX review so that you're able to retain those nursing concepts that you'll be expected to know. The second reason is that going back to the volume of information that you need to know, even if you look at one NCLEX review book, even if you only study from one book, a Lipton-Cott or a Saunders, you will notice that there is so much in that one book that if a student sits down and tries to digest it all, what I find is that you focus on the wrong things. You think you need to know one thing but you need to know another about it, or you just completely fly through a whole section of the book and being in your anxious state trying to study for everything. So you may be able to tell me all the different white blood cells, but you can't tell me what is the appropriate isolation precaution for somebody with meningitis. So there's a lot to know, and it's very good to have a framework to put it in, which an NCLEX review will do for you. The third reason is that there's so many NCLEX reviews that you have your option to pick what's best for you. A couple years ago, honestly, there was only one kind of NCLEX review. It was the live NCLEX review. A big name would come to a college or a university and everybody would go because they didn't have choices. So they would pay the $300, they would pay the $400, and there would be like really no questions asked. But now students are saying, no, I don't have to pay all this money. I don't have the time, it doesn't fit in my schedule, it doesn't fit in my budget. So they are getting questions text to them. They're getting NCLEX reviews on audio CD, or they're doing a review online. There's so many options. Just pick one that works best for how you learn as a student, where you're at financially, and make the best of it. Really, you have to take this test seriously, and you have to do all that you can to prepare for success. The fourth reason is that this test is computer adaptive. So that means that it develops itself as you're taking it. So there's no way to anticipate what subjects you're going to have, what types of questions you're going to have. You really have to secure a comprehensive knowledge of all nursing concepts in order to go in there and be able to successfully sit this test. So not only is it computer adaptive, though, they also throw in alternate format questions, which is they're going to be your fill in the blank, your multiple choice, your multiple choice, your correct multiple choice. I mean, sequencing, all types of things that I'm almost positive no nursing program in this country is using this form of testing to prepare their students. So this is a completely different test than what you would see during your nursing program. And the questions are not impossible to get correctly, but you do have to approach them differently than what you would naturally know as a student. So an NCLEX review will be able to teach you how to negotiate these difficult questions. The last reason is that taking an NCLEX review gives students confidence, okay? And I always say that this test is 50% mental and 50% knowledge, because if you're able to go into the examination room and know that you've done all that you can to prepare for this exam, then you'll have confidence in your answers. And when you encounter that question that you've never heard the drug before, or you've never been in that particular scenario, you're able to rely on the foundations that you've had during your NCLEX review and critically think your way to the right answer. Students who don't do an NCLEX review go in there second guessing the information that they know, second guessing all those difficult areas that they weren't really sure if they really got a firm grasp on, and they go in there defeated, and so they come out defeated. And in order for you to go in there with the confidence that you need, please do all that you can to prepare for this exam. There's so many free resources out there. The ReMar Review blog has tons of free NCLEX information. YouTube has information as well. Please just take advantage of it. I will continue to do my best to provide you with NCLEX skills and NCLEX tips and all those things that I think would be helpful that I didn't have. So continue to study with ReMar Review, and I'll see you soon.